Greetings, YouTube and fellow RSI sufferers. Alright, so I spent a few minutes just now as my computer was processing some stuff, poking around on YouTube and looking at some other instructional videos to make sure I'm not just duplicating someone else's effort, but actually adding to the information that's already out there. So yeah, I didn't do a search for tennis ball, but I'm sure there's something out there. But just from the RSI related videos, I didn't see anything about tennis balls. There's people recommending different stretches, different types of, go see a doctor, or go see a physical therapist if you're in pain, of course. But if you've learned how to manage your pain a little bit, like myself, and have already been to see doctors, and they, like me, I went for years and I saw physical therapist after physical therapist and chiropractor after chiropractor, because just the ordinary orthopedic doctors just don't have enough experience, so their nurses know more than the doctors do, which is the case in Sweden. I'm not sure what it's like in your area, but unfortunately it's like that here. So I've accumulated all of that information, aggregate information, into what I'm hoping is going to be a more compressed format and something that can directly help people alleviate symptoms and also prevent them, of course. So yeah, tennis ball, get one. Just a simple strengthening exercise for the lower arm here is holding it in front of you like this. Your elbow is about 90 degrees. And it's about chest height. I'll try to move back here a little bit. Crappy cam, sorry. Getting a better one. All right, there. So, and if you like, you can support your arm at your elbow like this, and just squeeze as much as you possibly can. Just crunch that sucker, as if you're trying to squeeze juice out of an orange or something. Just crunch it, and do that for about 7 to 10 seconds. And then release and just relax. And if you want, you can kind of just fiddle with it like this a little bit to relax the muscles in your hand and your lower arm here. And like, hold it like this first. All right, that's the first strengthening. You do that a couple, 3 times for 10 seconds or so a pop. You can tilt it back a little bit, tilt your arm back and crunch here, and that targets the whole mass of muscles in your lower arm, as well as the ones around your elbow. Like, you can, if you do this, you can feel these muscles here tensing up. And I would very often get cramps in these muscles here. I'd get muscle knots and cramps and stuff in, like, right around the joint, which was tremendously painful and would hinder movement and so on. And just, I just do a few shoulder rolls to loosen up. And the next one is turning your hand towards yourself, like like you're flexing your biceps or whatever. And again, just crunch that sucker, just like you're trying to squeeze juice from a rock, basically. And you do this 3 or 4 times. And these are exercises that you can do, when you're sitting at the computer waiting for something to process or whatever. It takes a few minutes. You do them with both hands, of course, for balance and for symmetry. Even if your left hand isn't as messed up, I still do the exercises most times with my left hand too, because just for balance and symmetry. As sitting at the keyboard does, it's an unnatural position for your hands. So getting one of those Microsoft Natural keyboards, or the Logitech Wave, like the one I have right here, which is a nice little wireless one that has the slight curve to the keys. That helps. The original Microsoft Natural keyboard was a lot better. It had a split midsection here, which provided for a better sitting position with your hands. Like normally in a normal keyboard, your wrists are bent. With the Natural, they're more kind of in a relaxed, straight arm position. So that's the first basic lower arm strengthening exercises with a tennis ball. Of course, after you exercise, you want to stretch the muscles and tendons a little bit. Some simple stretches are just, holding your arm out in front of you like this, stretched at the elbow, not tensing, stretching, and gripping the top of your hand and just kind of bending it backwards. And you'll develop a sense in time where your limits are and how much you need to do these stretches. And my recommendation is do them every hour. If you work 40 hours a week, take a break, 3-4 minutes every hour, and do some stretches and some strengthening exercises. Especially if you've already experienced RSI symptoms, because you don't want them to become permanent. Alright, so that's a simple stretch, and of course you can do it the other way around, like that, which puts a larger stretch or more intense stretch on your lower arm, or you just kind of stretch it like that and hold each stretch for 10 seconds. Count to 10. That is of the utmost importance, and when you release the stretch you want to do that slowly as well, so as not to cause any injuries on the way back, like from tensing to flexing. Alright, so that's a few simple underarm stretches you can do. There's of course a lot you can do for your shoulders and your elbow as well. There are some standing stretches that you can do, which are pretty easy. Among others, the interlocking of your hands behind your back, like so, and just stretching back, kind of putting your shoulders back. I had to squat down for this fit on camera. Stand up straight, roll your shoulders back, and kind of just stretch as if you're trying to, put your hands on the floor. But full body stretch, standing up, interlocking your fingers again, and stretching from side to side, like this. Hold each stretch for 10 seconds. Someone once told me, or I read, that it takes exactly 7 seconds for a nerve to stretch. And if you have nerve compression, like I often experience, doing these stretches can help a lot to help the nerves regenerate and not be in the compressed state. So yeah, and if you, like myself, have this sensation on the back of your hand, like someone's just gripping it and trying to yank your hand off when it cramps up, take a break. Simple. Tell your boss you can't come to work tomorrow. You need a break from the computer or whatever. Because if you push it and ignore the pain and pump yourself full of whatever painkillers and I saw someone on a video here, a guitar player, recommending people to take ibuprofen, which is completely nuts. That is a last resort. Painkillers, anti-inflammatories, muscle relaxants, last resort, people. That's just one step away from committing to surgery, in my book. You want to learn how to manage the symptoms without, having to rely on or become addicted to painkillers. Even worse, replacing one addiction with another. That's just nuts. So yeah, it's a lifestyle thing for most people, I've noticed. Most people that develop these types of injuries are hardcore gamers, computer gamers, or guitar players that play guitar for 12 hours a day, painters, tennis players, golf players, whatever. People that do repetitive things, overusing the same muscles and tendons and not allowing them to rest. So that is key to balance the whole, exertion and rest. All right, so that's some underarm stretches and exercises. Next video we'll cover some shoulder stuff. Feel free to comment, feel free to add whatever you come up with, and I'll take it into consideration for future videos. All right, thanks guys, and see you later.